Good afternoon, everyone, and welcome back to Novatek Medical Data Systems Got 15 webinar series. We are so back to be back with our final part, monitoring equipment and utilities for Novatek's new disease control and hygiene monitoring software. My name is Nisa Barkat, Associate Marketing Director at Novatek Medical Data Systems, and welcome back, Shiva, for part 4. Thanks for joining us today.
Thank you so much, Nisa. So I am Shiva Zaman. I'm head of our product specialist and training services at Novatek, and I'm excited to do part 4, monitoring equipment, with you today.
Great, Shiva. Let's get to it. As always, a quick reminder for our housekeeping rules. Our webinars we try to make them 15 minutes or less, and please submit your questions and comments below, and we'll get back to you via individual emails. All microphones are already set to mute for our attendees. And as always, you can find a recording of our webinar sent to you via email to those attendees. All right, let's get to it. Novatek Medical Data Systems, in response to the novel coronavirus COVID-19, we released disease control and hygiene monitoring software, saving patients' lives and protecting healthcare frontline workers through better data collection, analysis, and reporting. With that being said, Shiva, let's take a quick walkthrough on the workflow of DCH, disease control hygiene monitoring processes.
Thanks, Nisa. So yeah, just a quick review on this workflow. If you've seen our previous webinars, and I do encourage you to look those up, then you may be familiar with this process already, but there's basically certain high-risk areas that the DCH software covers, and within that we are providing early warning and detection. You might have seen story 1 where we monitor entrances, and through thermal cameras we are detecting visitors, patients, anyone walking into those hospitals, whether the traffic count is going up or whether an abnormal amount of people are walking in with fevers, and we're right away notifying for that. We do data monitoring and collection of those entrances, of personnel, of rooms and equipment for contamination control and to prevent outbreaks. And there's always early detection of that through the automated functionality of the software. And then we have analysis features that allows you to determine the source of the contamination, or at least assist in determining that source, and therefore making a timely decision on the response to that source of contamination, and then also preventing that in the future and containing it when it does occur. And through historical data, we do have predictive analysis that's available within the system as well. So just a brief overview again on the main 4 areas of risk that we look at within the DCH software. The first one is monitoring of entrances, which, as mentioned, is done through thermal screening of both amount of people coming in and their temperatures. And then we have the screening and monitoring of people, so personnel within the hospital, as well as the components like PPEs, so any equipment or component that's being reused. And then we have monitoring of locations. So that may be existing testing and sampling that's already being done in the hospital, such as swabs, dip slides, contact plates, sponges, in order to prevent proliferation, in order to determine really the high-risk areas and maximize the effort that's put forth to monitoring locations. And what we'll talk about today is very important, is monitoring of that critical equipment, such as an HVAC system, monitoring of environmental conditions, and monitoring of water and utilities. So all the previous Got 15 webinars are available online, and we'll link them through the description as well. So you may go and have a look at that if you haven't already. For today's story, we're looking at the monitoring of critical equipment. So we'll start with that, and then we'll move on to monitoring of environmental conditions and water and other utilities. So looking at equipment such as, let's say, an HVAC system, you can get through DCH a map and a visual representation of your testing of, let's say, an HVAC system, as you can see here. So the dots are colored based on whether the results being returned are within acceptable limits. And the yellow dots are actually above an alert limit, and the red dots are above an action a required limit that you set. So the user can set those and ensure that these HVAC systems are not spreading any type of pathogen, and that they are, maintained properly. So you can see that if they are not, as day 2 progresses, so we were at day 1, if they were not properly cleaned and it was not dealt with, that proliferates, and basically where we had, in day 1, we were mostly under control in these areas, P4, P5, P6, etc. As you go to day 2, you can see red dots start popping up throughout. And it only gets worse on day 3 with no attempt to clean, and you can see that is getting to the action required limit. You can also actually trend this data in a linear regression. So we've trended the month of February. Every day you can see the results and then a linear regression through that. So you can see if you're maintaining a constant state of data versus if that data seems to be going in an upward slope and requires then action. And this is what we mean by prevention. So you can see that trend coming before it actually hits an action limit. Here you can also see the number of results above alert and action levels for any given equipment, group of equipment for the entire facility. So you can see percentages there and ensure, again, that you're taking action as required. And let's go into environmental conditions. So here is a graph of the temperature and humidity. As we know, environmental conditions do affect the proliferation of viruses and pathogens. So ensuring that that maintains within acceptable limits, and that can be graphed, and notifications can be provided if those limits are not met. And then you can actually drill down to specific temperature probes. So let's say you do see an issue with temperature. Is it an issue of the probe? Is it an actual temperature issue? Where is that located? So you can drill down to those probes, and you know where those probes are located within the system, and then identify the source of the issue that way. So monitoring of water and other utilities. So let's get into that. So effluent wastewater monitoring. So this is a graph of exactly that. And you can see that you can obviously monitor those water samples, as well as within the software, identify which, if any, pathogens are found, such as COVID-19. They can be tracked, and you can filter the data in order to see it from multiple angles. So where was that found? Who took that sample? And kind of analyze that to determine what the risk is, what the potential impact is, and how to prevent that in the future. So let's get into that. Here we've monitored actually by department to see the results coming from specific departments. And then you can see that as soon as a cleaning was performed, there was a sharp decrease in the count and in the numbers. Within the system, as you're entering results, and that's what we're looking at here, the results entry screen, as soon as a limit is exceeded, and we help you determine what those limits should be through the trending, or at least justify your limits or revise those limits to be as efficient as possible. They are highlighted when you do reach a limit in yellow and in red for, again, hitting that alert level and hitting that action level. Just to summarize, Risk number 4 was really that monitoring of equipment and environmental conditions, and the ability to properly monitor those helps prevent further proliferation. So if you did have an issue in one area, that equipment could potentially proliferate it if it wasn't dealt with in time. We do trend in order to visually identify contamination spread through equipment. We saw that map of the HVAC, as well as to prevent contamination by seeing the trend of the numbers rising and potentially predicting when they would reach limits in order to take action. So we also have an investigation tool throughout, and we help you investigate by helping identify the origin point. You can see it both on the map, and you can see it by trending on the different factors like we did, drilling it down to a particular probe, looking at person who handled the samples, what equipment it was, how it may have originated, can all be trended and visually seen. And just to help you perform targeted smart cleaning, targeted sampling at high-risk areas, and help you service equipment as needed, when needed, and kind of make those adjustments to run more efficiently as well as safely. So that's an overview of monitoring equipment. And of course, you can contact us for a detailed demo of that monitoring equipment and all the other points within the DCH software. Overall, throughout these 4 webinars, we've really looked at how DCH can help you maximize the resources you put towards monitoring hospitals and ensuring that they're safe by using automated equipment such as the thermal cameras are completely automated, as well as targeting high-risk areas when doing sampling. So you are efficiently sampling in order to ensure that you are containing and preventing outbreaks within that hospital. And then, seeing and detecting that contamination early by trending sources, potential sources of contamination, investigating and determining the root cause. And overall, this is a centralized real-time database that helps decision makers respond rapidly. And we're really proud of this solution because we know that outbreaks are not a one-time event. We're seeing it throughout the years. COVID has reached the level of a pandemic, but this is a reoccurring issue that can easily be managed to keep hospitals safe and patients safe. And having said that, I'm going to pass it on to Nisa to continue our discussion on outbreaks and wrap up this session.
Shiva, thank you again. That was an excellent conclusion to our 4-part series. I want to reiterate something you said at the beginning of today's presentation. Maintaining a constant state of control equals prevention. And at Novatek Medical Data Systems, we had put together these 4 quadrants together to put a holistic solution, an end-to-end solution, so these healthcare facilities can maintain that constant state of control. State of control is a very common word in our industry that we serve, the pharmaceutical and biotech industry. And now it's time for other industries to adopt the prevention methods. And we started this webinar series back in June, and it's now almost 2 months. June 30th was our first start time for our first webinar on monitoring entrances. And Shiva, I'm sure you've seen in the last 2 months how our society has adopted to be adding thermal cameras and real-time monitoring. And now, almost 2 months later, we can see how we are moving forward and progressing to live with COVID-19 and make the most of what we have and to benefit from the technologies that are in place to maintain a state of control and to always be acting in prevention.
I couldn't agree more. Sorry to interrupt you. I just want to emphasize that point. and like you said, in the last few months, we're seeing offices adapt to a new way of working. We're seeing hotels, airports, public places implementing thermal cameras. But of utmost importance, of course, is these healthcare facilities, and the healthcare facilities need to have the top technology here. You know, our level of thermal screening is above and beyond, you know, your average thermal camera that you may have in a hotel, right? It's precise, and it's something that's needed in an area such as a healthcare facility, which is specifically the place that people go to heal and get better. You want to give them that safe space, both for your patients as well as the staff.
100%. And again, alongside with the cleaning methods, I think what was really great about the series was when you went over the concepts of ensuring that effective cleaning was done. Our data and our graphs actually showed positive return when effective cleaning was performed, and the differences that can make. And over time, that adds to maintaining a state of control. We hope everyone was able to take these 4 criteria that is part of Novatek medical data systems, disease control and hygiene monitoring systems. Take these 4 criteria to understand the importance of prevalence, and therefore the importance of rapid decision making. So we are wrapping up our 4-part webinar series. All of these will be available on demand. We thank everyone again for your time today. Please do contact myself or Shiva if you would like to see a full demonstration of Novatek DCH's system. And of course, connect with us on LinkedIn, and let's get the conversation started to get our healthcare facilities, to get our elderly care facilities to adopt and be able to adapt to these technologies so we can always be in a state of control and a preventive state. Shiva, thanks for your time, and thanks for being part of this webinar series.
It was a pleasure. Thank you, Nisa.